and it's my pleasure that today we
Yeah.
could hear this specialist, and please enjoy and
Yeah.
also ask maybe not about the dry eyes because doctor have a lot of experience, and I'm sure that she could also answer for all your
I would
questions.
like to ask a few questions, but I will I will try to answer the question. Yeah. Uh, because look, we have taken this data from American Academy of Ophthalmology and American Academy of Optometry. Yeah. And the point is that now I'm working and practicing in Sweden, not in Latvia, despite that I'm a Latvian doctor. Yeah. But I have not worked in Latvia since 2008. For this reason, I can tell exactly that in Sweden and in USA, these guidelines are actually the same. Yeah. In Sweden, I'm using regularly rose Bengal and Lysosin green. Yeah. But I have spoken now to our professor, Gunta Kruminia, just 5 minutes ago, and I asked her if it is rose Bengal is available in Latvia. But she could not answer my question exactly, and she opened even our special agency who are registered medications, and she could not see this rose Bengal and Lysosin green. But I have strong idea that most probably somebody who have his own optical shop, I mean optometrists, yeah, still can use this piece of paper because it's not a drops. It's just small papers with color. Anastasia, can you tell me some comments about this? Let's suppose
Yes.
I give you a present. I will bring, I will come back from Sweden and bring you this pack of rose Bengal. Yeah. Can you use in your practice this rose Bengal like a papers, small papers, just to stay in your eye, these eyes of your patient?
Yes, thank you, Teresa, for the question.
Mhm.
I, as optometrist, what graduated the Latvian
Mhm.
University of Latvia and Department of Optometry, can say that in Latvia, in my clinical practice, I could use the fluorescein stain, and we are using it for evaluate the ocular surface. But in our practice, I'm not using the Lysomin green and also rose Bengal. I see the question about the is fluorescein enough to diagnose since there is no possibility to use other two dyes. As I can comment that
Yeah.
fluorescein staining mostly is performed for the corneal staining, but Lysomin green will be namely more sensitive to stain the conjunctiva, and
Right.
it will be
Mhm.
less toxic as rose Bengal. So, unfortunately, if you don't have, for example, these both, you couldn't say pretty sure that the patient doesn't have any changes in conjunctiva. I hope I'm answered on this question.
Yeah. So, colleagues, I can tell you there is Guna Puca, yeah, who answers that we can use, yeah, this stain, yeah, in Latvia, as I suspected, because I'm pretty sure that my colleagues in Latvia, doctors, I'm speaking about doctors, somebody is using this rose Bengal or eventually Lysosim green, because some conditions, yeah, it is impossible to do proper diagnosis for some conditions like Sjogren syndrome. Yeah. And I would say this conjunctival staining, which we can see in this grading scheme, yeah, it's it's very essential, yeah. And I'm going exactly to discuss with you, showing my presentation exactly about these other eye diseases, about the other eye diseases and eye conditions, yeah, which can lead to dry eye disease, yeah. Because I would say you have to think like there is just normal dry eye disease, and there are some other conditions like Sjogren syndrome, which is not just simple dry eye disease. Yeah. And by the way, this Sjogren syndrome is quite spread in our population. In Sweden, there are quite a lot of people, yeah, who have this Sjogren syndrome, even light form, yeah, or some other autoimmune diseases. And I'm pretty sure that in Latvia we have a very similar situation, yeah. And my answer will be to this: should you use only fluorescein? No, you have to use something more. One of these, yeah. Of course, you can try to do proper evaluation of patient with suspected dry eye, yeah. Just using this left side of this table, yeah, you can just ask patients about complaints. Number one, you can do one other thing, visual symptoms. You can ask patient about visual symptoms, yeah. You can evaluate conjunctival injection without anything, yes. You can evaluate corneal staining, yeah, using fluorescein, yes. But you can't do proper conjunctival staining, yeah. And even yeah, I would say mostly it is about conjunctival staining, but it's quite important thing to do it, yeah. I would say you can't detect Sjogren syndrome without rose bengal or lysozyme green, yeah. I will just go a little bit directly to this Sjogren syndrome, yeah. It is, just look at this grading table, yeah. Dry eye severity, yeah. I consider that it's very, very good table, which you can use every day, yeah, when you have somebody with suspect dry eye and somebody who wants to start to use contact lenses, or eventually somebody who is already using contact lenses, yeah, contact lens user, yeah. And I think it's very, very good option, yeah, how practically you can evaluate severity of dry eye disease. Yeah, of course, I would not say that you have to do it with every patient who is using contact lenses or with every patient who wants to use contact lenses. But you know what? Try to use this table or this evaluation of dry eye severity level, yeah, for patients who already have some complaints. Yeah, if you ask me how you can do it practically, yeah, really, if person don't have any complaints, yeah, and he has a pretty good breakup time, yeah, around 10 seconds, yeah, so no any complaints and breakup time is okay, yeah. He can use contact lenses without any problem. But if patients start to have some complaints, yeah, about discomfort, yeah, and some visual problems, and you detected some corneal staining, even little bit corneal staining, you have to think what to do with this patient, yeah. And it would be very good if you can just guess approximately what the problem is, Yeah. Of course, you can send to ophthalmologist every patient who has some dry eye syndrome. Yeah, but I don't think that it is good idea to send every patient who have some little bit staining on the cornea. Yeah, to ophthalmologist. Yeah, for this